Lung diseases continue to be a growing problem here in the Philippines. In fact, chronic obstructive pulmonary disease is one of the most common reasons why people do have lung diseases. It is a leading cause of death here in the country, and those living with it are at an increased risk of a number of other conditions. Proper awareness and early detection can significantly improve the quality of life of these individuals. On the program today, we'll talk about the symptoms of the disease, its diagnosis, prevention, and of course, its treatment. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. A big reason chronic obstructive pulmonary disease, or COPD, is so common here in the Philippines is because patients often fail to receive proper care early on. Now today, our guests are here to tell us what signs to watch out for and the best treatment possible. With us is Dr. TRISTAN JEDIAH LABITAD. He is a public health specialist from the Philippine Society of Public Health. We're also joined by Dr. PERCIVAL Pangilinan. He's the section head of the pulmonary medicine at Cardinal Santos Medical Center. Now, early on, we mentioned that COPD is a leading cause of death here, as well as the entire world. But as widespread as it is preventable and it is treatable. Now, Dr. Percy, let's talk about COPD because it's not just one disease, isn't it? It's a term that describes a significant amount of diseases, actually.
It is very common, treatable, and preventable disease, which is very rampant in our population. It is sort of something which is really preventable if you are going to look at the risk factors for the development of COPD. The COPD traditionally was defined as being a spectrum of two entities, namely chronic bronchitis and emphysema. So they're at the end of both spectrum, but majority of our patients who have COPD is a mixture of both. They're somewhere in the middle.
We can think of it as a spectrum of diseases. So Dr. TJ, let's talk about that.
If you talk about COPD, the common symptoms of this develop from midlife onwards. Now, this includes breathlessness or difficulty breathing. Second is chronic cough, often with phlegm, and tiredness. And mind you, COPD during its flare, or these people with COPD during the flare find their symptoms much more worse than they require additional or extra hospital or home care. Much worse, they will be warranted to be admitted in a hospital for emergency care. Severe flare-ups in COPD can be very life-threatening.
Dr. Percy, how long does it take for some of these signs to progress, to become worse in a patient who has COPD?
You cannot answer that question without discussing one of the major risk factors for developing COPD, which is cigarette smoking. Now, it has been studied that as the number of cigarettes that you smoke increases, and the number of years that you have been smoking also increases, it likely increases the possibility of someone having a COPD. Now, it has been studied that people who smoke will need to have 15 pack years of smoking before they develop symptoms of COPD.
Now, Dr. Percy, let's go back to the symptoms here para clear sa ating mga viewers, especially. It can be confusing sometimes of what chronic bronchitis looks like, what someone with emphysema may look like. That's why there are some terms here. For those with chronic bronchitis, they're called the blue bloaters. Why is this so? And for those with emphysema, they're called the pink puffers.
First off, chronic bronchitis is inflammation and swelling of the inner lining of the airways of the patient with COPD. Now, with this inflammation, there is increase of sputum production or mucus secretions. And with the increase in the mucus production and the inflammation going on in the lining of the airways, this narrows down the airway caliber, producing the airway limitation or airflow limitation in patients with chronic bronchitis. The reason why they're called blue bloaters is that their oxygen level usually goes down. On the other hand, emphysema, those patients are called pink puffers because they are the ones who really show signs of having difficulty of breathing.
Now, Dr. TJ, let's talk about chronic bronchitis specifically here. We'll talk about the reasons why someone may be at risk for that later on in the show. But I'd like to talk about the distribution of this, males versus females, because there are some reports of higher rates of chronic bronchitis in women compared to men. Why is this so?
Our researchers are not actually sure why COPD affects women more, but this may be linked into some points, like example, the number of women who smoke is now as high as the number of men who smokes. Now, experts think that cigarette smoke may be more damaging to women's lungs. Why? Because women's lungs are smaller and their bronchial tubes are also smaller than men. So the same amount of inhaled smoke may cause more damage. Some studies show that breathing pollutants as well, given that women's lungs are much smaller and its bronchial tubes are much smaller compared to men, the same amount of inhaled pollutants may cause more damage to women.
Would you say that someone who has, say, chronic bronchitis, if left untreated, if their lifestyle does not change, that they will eventually get to the point of having emphysema?
No, there are 4 stages. Stage 1, Stage 2, Stage 3, and 4, mild, moderate, severe, and very severe respectively. Yung sinasabi nga kanina, will explain ni Dr. Sino, but in the Stage 1, you may have no symptoms at all for Stage 1 of COPD. For Stage 2 naman, the moderate, you might have to stop every few minutes to catch your breath. And the severe stage, that's a Stage 3, you may be too short of breath to leave the house. Even undress and undressing might require you to be breathless na, no, for Stage 3. At the Stage 4, of the very severe stage of COPD, you might have a lung or heart failure.
So similar to chronic bronchitis, it's characterized by persistent cough. There's wheezing and there's also almost always some fatigue involved. Now your doctor will likely run tests to see how well your lungs are working. And if diagnosed with emphysema, you won't be able to empty your lungs of air as quickly or as effectively as you should. What causes this airflow limitation? When we return, we'll talk about risk factors that contribute to emphysema, chronic bronchitis, and COPD in general. Now, we're your partner in healthcare. This is MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. If you find yourself with these symptoms of wheezing, being fatigued, have those risk factors that we'll be discussing later, you might have chronic obstructive pulmonary disease or COPD. Now, it's a group of lung diseases that make it difficult for people to breathe. But there's another type of lung disease that also causes some form of swelling in your airways and some form of difficulty in breathing, and that is asthma, which is an extremely common condition here in the Philippines. The Department of Health reported that 1 in 10 Filipinos were suffering from asthma as of 2017. Now, Dr. Percy, let's talk about asthma for a second here. What happens to a person's lungs when they have asthma, and how does it differ from COPD?
Asthma is usually seen in the younger age group, while COPD patients usually start having their symptoms after the age of 40 years old. Another difference is the symptoms of COPD tend to be progressive. Ibig sabihin, palala lang ng palala yon. While in asthma, it's very variable. Meaning, if the patient with asthma, particularly the mild forms of asthma, if they do not have any attacks or exacerbations, they seem to be very normal with no airflow limitation and no symptoms, no wheezing, nor shortness of breath.
Now let's talk about the causes. We've been touching on some of the risk factors earlier on the show. Let's talk about the causes, the main causes of COPD here in the Philippines. Dr. TJ, can you start off on that? We already know how cigarette smoking is a big factor in COPD, but we also have other risk factors such as exposure to secondhand smoke, the kind of work the person does, even some elements in cooking can actually cause COPD. Could you talk about some of the risk factors for COPD?
Aside from smoking, those smoking can cause lung diseases, given that this is really one of the top risk factors in COPD because it destroys or it damages your airways and the small air sacs or the alveoli. Now, lung diseases caused by smoking include COPD and emphysema and chronic bronchitis, as stated earlier. Again, and also to note, cigarette smoking causes lung cancer or different kinds of cancers for that matter. If you have asthma as well, tobacco smoke can trigger an attack or can make an attack worse. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. Although non-smokers are also exposed given that there is this secondhand smoking.
But Dr. TJ, another possible cause of COPD is air pollution because in 2020, the Philippines ranked actually 57th among nations with the worst air pollution. That's according to IQ Air's World Air Quality Report. Now, my question is, air pollution here in the Philippines, a lot of factors come into play here. Industrialized factories, diesel is a very common fuel used here in the Philippines, especially in big cities. How big of a factor is air pollution in causing COPD?
Naturally kasi ang function ng lungs natin is to breathe in oxygen and breathe out the unnecessary gases sa ating mga katawan. Though given the environmental factors or exposures with this air pollution and other factors at that, it is very detrimental to the health of the lungs of every individual that inhales these gases. There has been report as well that these occupational hazards, nakikita natin yan sa mga report natin, and not just COPD and even occupational asthma, kasi we've talked about asthma earlier. There is also this occupational asthma na nakikita natin, which causes, again, the wheezing, the cough, the irritation of the lungs, etc. Given that the environmental factors as well, this warrants every patient or every individual. Lahat tayo exposed, lahat tayo vulnerable because we are in one planet. That is why we should really consider taking care of our environment kasi that also means taking care of ourselves.
Now let's go to one of the big ones, which is cigarette smoking. Dr. Percy, I know many Filipinos are aware of the bad effects of cigarettes, but I'd like to touch on something which is very common nowadays, and that is heated tobacco products, which include vape smoking, as well as other types of non-combustible ways of smoking, kumbaga. These vape products are still fairly new. The data probably isn't that comprehensive yet, unlike cigarette smoking, where we have over 60 years worth of data. What do we know now about vape? Is it a safer alternative to cigarette smoke?
So far, we have had a few studies which say that the vaping is really safer than cigarette smoking, but it will also entail the same risk factors for developing your chronic pulmonary diseases.
COPD is preventable and it is treatable. When we return, we'll talk about ways in which those diagnosed with COPD are managed and treated and what you can do to help prevent it from happening. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk. Living with chronic obstructive pulmonary disease, or COPD, can be overwhelming for a lot of people. But there are many ways that individuals can ease the symptoms and keep the disease from progressing. But most importantly, what we want to advocate here is prevention. Doc Percy, let's talk about some of the treatment options for someone who is initially diagnosed with COPD here in the Philippines.
It will depend on how severe their COPD is. Now, as far as medicines are concerned, the mildest form of COPD, we can do away with giving just short-acting bronchodilators as needed. Now, as you go up higher in the severity scale, we have these, what we call long-acting muscarinic antagonists in the form of inhalers. And then if that doesn't work, we go to long-acting beta-2 agonists. And for the more severe patients who seem to not respond to your previous medicines, we go for combinations of all of these things.
Now, Dr. TJ, we've been talking about ways to prevent this. Ideally, let's talk about the biggest risk factor here, which is cigarette smoke. Now, ideally, you wouldn't want to try and find something safer because cessation of smoking is the best option here. Now, my question is, for someone who is diagnosed with COPD and they take away that biggest risk factor there, could be cigarette smoking or their occupation, maibabalik ba? Babalik ba sa normal ang kanilang lung situation?
Maibabalik ba sa normal yung lung? With COPD, hindi na siya babalik sa normal. But given the staging that I stated earlier, no, mape-prevent natin ang severity of this staging of COPD with a patient. Now, if you have started smoking, from today, start to quit na. No, we have smoking cessation clinics available in our rural health units, sa ating mga rural health centers, and also in our DOH retained hospitals. There are trained individuals for you to be assisted on how you will quit smoking. And for those who have not started smoking yet, do not ever start smoking. For you to not be able to be exposed to COPD and other lung diseases. No, hindi na siya mababalik, mape-prevent lamang natin ang severe or on its severe form ang inyong COPD.
Dr. TJ, that's interesting. Could you talk a little bit more about the smoking cessation program that you have? What is the goal for someone who is addicted to nicotine? What is the goal here? Is it complete cessation or is it replacing that habit with something that is less harmful?
Actually, it's the smoking cessation clinic. It's a process. No, it's not a one-time, big-time treatment for smoking cessation. The patient or the client will be assessed first and will be counseled, and they will go through a process, no series of processes for this individual to be able to really get rid of the want to smoke. So hindi siya one time, big time, and it's not a replacement of nicotine or whatsoever na sinasabi nila. So might as well, if you are a smoker, please visit the nearest DOH retained hospitals or your nearest health centers, because these individuals are trained to conduct smoking cessation. They have smoking cessation clinics in the respective RHUs or health centers and hospitals.
Now, Dr. Percy, let's talk about how to keep someone's lungs healthy, because we're exposed not just by secondhand smoke, but so many environmental things. How can our viewers keep their lungs healthy?
One of the best ways for you to keep your lungs healthy is, of course, to avoid smoking. If you are not yet smoking, don't start. And for you to avoid being exposed to noxious particles and gases. And that's one thing that it's done nowadays because of the pandemic. We are so used to using our masks as a protection. So in itself, it has been studied that wearing the mask has decreased the likelihood of patients with COPD to be exposed to trigger factors that might exacerbate their condition. And of course, a healthy diet will benefit your lungs and your whole body as well.
And with that, thank you so much, Dr. TRISTAN LABITAD and Dr. PERCIVAL Pangilinan, for being with us today and sharing your insights and sharing your expertise when it comes to COPD. We appreciate your time and your insights. I'm Dr. Freddy Gomez, and thank you for watching Med Talk Health Talk. We'll see you again next time.